First order of business of tonight is approval of minutes. In our packet, we do have minutes from June 22nd. Donna had emailed all of us earlier to let us know that as she typed up the minutes, she realized that at our last meeting, there was actually a motion and a second on the motion, and then we got really enthralled in our discussion and never voted on the motion, and then had another motion and kind of moved on. Joan, you had made the motion and Dave Catania seconded, and it was around the survey, and it was when you had made the motion to have the survey be more qualitative in nature. It's on page second, the second paragraph, page 7, the second paragraph of the minutes. This will be on our agenda next week, so we can pick up this discussion again. But I think what I need to clarify tonight, Joan, is if you want that motion to remain and we can pick it up next week, or if you want it to retract the motion.
Sorry, I was just looking at the executive session minutes. I need to find that motion in this. Page 7, you said? Yeah,
page 7 says Dr. Gibble made a motion to make the survey.
The longest motion ever made. That was that motion.
Yeah, that's why we got so thrown off. Do you want the motion to go back on the next meeting when we talk about this again, or was the rest of the conversation productive in your view?
I don't think we retracted that motion. I don't think I want to retract that motion.
Okay. So I believe, unless anybody else sees a different way procedurally to go about this, that we can pick that motion back up at the next meeting, or does somebody else have a suggestion for how to handle this?
I think that's fine.
That's fine. Okay. Okay. So do we want to approve the minutes as they are, and then Donna will reflect in our minutes for tonight that we will pick that back up next week?
This is Dave, so moved.
Thank you, Dave. Is there a second?
I'll second.
Thank you, Maya. So all in favor?
Aye.
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 All right, great. If I miss a motion tonight in any lengthy discussion, somebody call me on it. But we do have a second set of minutes to approve, and that was the executive session of June 22nd, which started at 6 p.m., wrapped up at 7, and then resumed again after our business meeting. Is there a motion to approve those minutes?
So moved.
Thank you. Is there a second?
I'll second.
Thank you, Dave. All in favor?
Aye.
Aye. Okay, unanimous. Great. Dr. Thompson, do we have any correspondence this evening?
We do not. We do not.
Okay. And Dave Catania, you said you do not have a warrant report tonight, correct?
There are no warrants this week.
Okay. Thank you. So next on our agenda is public forum. And once again, public forum is via our email address, npsschoolcommittee@nora.k12.ma.us. At this time, I do not see any emails at that address to be read at public forum. But as a reminder to the community, you can email us anytime tonight until next Wednesday. And if there are any emails in that address, I will read it at next week's public forum. So moving right along, any announcements, Dr. Thompson?
No, most of them I'm going to wrap them into my presentation on our school reopening update number 2. So.
Okay, thank you. So we do have a few guests with us tonight on appearances. We are switching the order a little bit from what you see on your agenda tonight. And first up will be Paul Riccardi, Director of Facilities, and Jill Driscoll, our head nurse. So Paul and Jill, welcome. Thank you for joining us tonight.
Thank you.
Thank you.
So in the package, we do have some material for both, but do you want to guide us through, Paul, what you've been working on?
So we are obviously working on getting the facilities in the best possible shape that we can. It's our routine summer cleaning that we had the opportunity to start in April. Just so that you know, our custodians have been in the buildings since March 23rd when the world stopped. full time and have made great strides. We've got a lot of painting done this year, as well as our regular cleaning, and our maintenance is far ahead of where we would normally be at this time on most summers. So we're in good strides. Between Jill and I, we have spent since March 23rd talking almost every day. Jill refers to me now as her work husband, but we are continually searching and scouring for personal protection equipment, cleaning supplies, and we put together a quick list of what we've purchased to this date. And did everyone get that?
The list of what you purchased?
Right. You asked, in one of your questions, you asked for our supplies.
Yes, I did ask, but I didn't see the list. Dr. Thompson, did you send that along? Did I miss it?
It's in the agenda if you click on these and in between school health and safety measures.
Oh, I apologize. That was added in the last couple of hours, I think.
I happened
sorry.
upon that.
That is in our packet, Paul. Thank you.
Okay. And just to let you know, from I believe from both Jill and myself, our list is what we have, not necessarily what we've ordered. The market and the supply chain is so up in the air that I haven't counted stuff that's been ordered because we don't know when and if we're going to get them. Like this morning, I received another 4,000 disposable masks. So our total disposable masks is just a little shy of 20,000. The hope is, and I think Desi and Dave, you can correct me if I'm wrong, Desi is strongly recommending that families provide masks, and that our masks are, to fill in if someone doesn't have it or they lost their mask, not to be giving out on a daily basis, basically, for use. Because if you take our student body, we can go through 20,000 masks in a month very easily. We have, just from a cleaning point of view, just to let you know, we have been spraying our schools for the last 3 years. We bought adult-sized squirt guns 3 years ago, and we've been working with Jill and the nurses, and whenever they tell us there is an uptick, whether it's flu, whether it's a stomach virus, we go in, strep throat, they tell us, and the guys go in and they spray. So our guys are very comfortable in spraying. We've been doing it, as I said, for 3 years. We are, you asked what, so if we get to the HVAC systems, so as you know, that none of the elementary schools have central air conditioning. Most of them have boilers with gas heat, and the bulge has boiler with oil heat. The boilers are maintained. They're PM'd once a year and repaired as needed during the year. The problem in the elementary schools, and I think, Teresa, you asked me what one of my big concerns are, is in the spring, late May, middle of May to the end of the school year, and in the fall, September to the first couple of weeks in October, our schools, the elementary schools, can get extremely hot. Classrooms can go into the 80s and 90s. We have fans in the room, but under COVID, we can't use those fans because we can't move the air at a high velocity. And I envision a bunch of little kids trying to keep their masks on, and these rooms potentially, maybe we'll be lucky and have a cool fall, but these rooms potentially heating up. That is a great concern to me. And at the high school, 10 years old, it's what we would call a modern HVAC system. We are on a regular basis mixing. The windows are closed because it's a completely air-conditioned, centrally aired and centrally heated facility. They can open windows. And we bring in the mix is 30% outside air. So you take in a volume of air, you heat it or cool it, 30% of that air is exhausted, and more air is brought in. We have the ability to raise that percentage. I'm not sure that that's needed, although we're exploring with our control people to look at potentially doing 2 purges a day of 100% outside air. That's in lieu of having to open up all the windows and flush the building out. And we would do that at night, and we would do it once during the day. There would be a fluctuation in temperature, either hot or cold, depending on what we are, what system we're running. And there is a cost, but I don't really factor in, because, you know, it's going to depend if we have to do it in the winter, how cold is it outside? It's different degrees. You know, 32 degrees is one thing. If it's down to 10 degrees, it's going to cost a little more to heat that air up. The Coakley Middle School, as I said, is old but functioning. It is serviced, the systems are serviced every year. In all the schools, we change the filters 3 times a year, so that any air that we're taking in or pushing in through the rooms is clean with our filters. But the Coakley system is old. The Coakley system, I've been here 9 years. I think 2 or 3 years before I came, there was proposals with the MSBA to replace the Coakley system. That, for a lot of reasons, never happened. And now it doesn't look like it's not financially feasible to do it, given that we're hoping to build a new Coakley. But the guys are on top of that. Our outside vendor that maintains it shows up immediately if there's a problem. The Coakley also has a mix of outside air, and it's somewhere, given the age of the system, it's somewhere between the 15 and 30%. The windows in the Coakley are open on a very regular basis during the school year. The Willett is another all-electric building. It is centrally aired because a long time ago it used to be. It's not centrally aired. It's mostly all window units, because a long time ago it was the administration building. So there was quite an investment made for window air conditioning. So they are cool, but window air conditioning is just like our homes, whether we use window units or central air. We're not bringing in outside air. So the only way to bring in the outside air is obviously to open the windows in the Willett. Same applies to the Little Mustangs. All the rooms are air conditioned, but again, to bring in outside air, we'd have to open the windows to get the air exchange. The Balch has even probably gets hotter because we've got 3 floors, and that top floor heats up relatively quickly. But again, the windows open. The Callahan windows open in the Callahan classrooms, not centrally aired. So my biggest concern is for the elementary schools what the temperatures are going to be. My second biggest concern is in all of our buildings, and I'll just run down them quickly. The Balch, we have 3 custodians, the Callahan 2, the Cleveland 2.5, the Oldham 2, the Prescott 2, the Willett 2, the high school 7, the Coakley 5, and the Savage 2.5. We're going to have, and the shifts, I'm just going to talk about the 2-man buildings now, and that includes the 2.5-man buildings. Basically, the shifts run 6 to 2:30 and 1:30 to 9:30 or 2:30 to 10:30. We're obviously going to have to bring in the evening person earlier, because he's going to have to help the day custodian with bathrooms and however we handle lunch, which has not been determined. And then they're going to have the bathrooms done. If the evening guy is now working 11:30 to 8:30, we're going to have the bathrooms done for the evening before the senior custodian, the day custodian, leaves, so the evening custodian can do clean the classrooms and do all the surfaces, disinfect all the surfaces, touch places. I'm concerned with, and I'll be quite honest with you, I'm concerned at the Cleveland, the Prescott, and at the Savage, we're going to have, if we have extended day, we potentially have kids there until 6:30. The hours don't work if we have to move up our evening custodians and have whatever number of kids still in the schools until 6:30 at night, which would probably necessitate a fair amount of overtime in those three buildings. If we go to a hybrid model, we are looking at spraying on Wednesdays and then spraying on Friday nights or Saturday morning. During the rest of the week, we will be, doing our usual cleaning and disinfecting of all the touch surfaces. Just to tell you about the supply chain, you cannot get Lysol wipes anywhere, retail or commercial. We've found a supplier that will give us big rolls of wipes and buckets, and we pour the disinfectant in, and it acts like the Lysol wipe. We've got two different kinds of disinfectant. We got one that kills everything within 2 to 3 minutes, and then we have food grade disinfectant that kills anything in 1 minute. So, it is going to be a challenge, but I'm confident that we can work our way through this, whatever folks decide the school year is going to operate. The one other thing I know, Teresa, you asked about toilet lids, and I'll defer to Jill to answer that question. There are no toilet lids in any of the schools. There are no toilet lids in any commercial or public building. But I'll let Jill talk about the science of that. So, we're kind of, from what this is really going to cost us, we're kind of in a holding pattern because we don't know what we're going to be doing and which of the three options will we be taking. But we're buying equipment and supplies as if the kids are coming back because we have to do that. We just placed an order today for 500 arrows for marking the corridors on which way did you walk, and we'll have to get some 6-foot separation ones. So there's a lot of prep. We've got storage trailers coming tomorrow for every school. We have to get them because it'll be too late. Everything is disappearing in the supply chain very quickly. So I don't know if I've covered everything you want, but that's it in a nutshell. I'd be happy to answer any questions.
Thank you, Paul. I think Maya has the questions.
Yeah, Paul, in terms of like the Willet with the window air conditioners, are they allowed to run those window air conditioners? Is that a problem in the same way that a fan is?
No, I haven't been told that is a problem.
Okay.
I mean, I'll double. The gal's going to be on tonight, so I mean, we can ask that, but I haven't been told that we can't run them.
Okay. And then the other question I had was, I agree with you that the elementary schools tend to get really hot if the weather's warm and sunny, especially. But I know that like when we replaced, I guess at one time there were concerns at the Callahan about having screens for the windows when they were open. How many of are there still windows in the elementary schools that don't have, that we would want to be opening that don't have screens?
There are some, and it's primarily at the Callahan and the Balch.
Okay.
There are other questions for Paul at this point, Joan?
I'm not sure if this is for Paul or for Jill, but could you talk a little bit about the study carols that are in the list?
That would be Joe.
Yep. So I have ordered study carols for grades 1 through 5. They have white sides, but the front is clear plexiglass. So there's one for each student. They can collapse and they can be moved around if need be. Although there seems to be some concern about cross-contamination, moving children from classrooms to specialist rooms and things like that. But there are study carols for grades 1 through 5.
Thank you.
Other questions from the committee, Dr. Thompson?
I was going to ask if Jill wanted to talk a little bit about her supplies and what she has on that list. I mean, I know the committee can look at it, but people at home would have trouble to seeing that right now.
So I think Paul and I have tried really hard to coordinate our efforts so that we're using our money as wisely as we can to have the supplies that we feel we may need, but not to go over the edge into hoarding. I think that my thought is that I would ask all staff and families to come to school wearing a mask and have a spare in their backpack or purse or whatever, just in case. And then I believe I have enough masks in case somebody forgot or their ear elastic snapped or their mask fell in the toilet, or goodness knows, we have lots of reasons to lose our masks at school. So I don't know if Dave had let you know that there's a group called Making Masks in Norwood, and they were kind enough to donate a large, almost 500 masks, cloth masks. I purchased, or in the process of purchasing, some gator masks, because I think for some students that will be a more comfortable alternative. I have KN95, which are one step down from a medical grade mask for the school nurses, for the custodians, and for the teachers who work with our severe special ed population who may or may not be able to tolerate a mask at school. I have face shields for pre-K, K, and special ed teachers, as well as our super special education population, who again might not be able to comply with wearing a mask at school. For pre-K and kindergarten and the special ed teachers, I've purchased like scrub jackets so that they will have long sleeves and something over their street clothes, just because some of those friends are very generous with their personal secretions, and I don't think they want to share those with anybody else. Trying to think what else. We have no-touch thermometers and have had them in the past, just because they work well for all student age groups, and especially in a time of COVID when you want to minimize the amount of touch. We have those. I have been and started back in March and continue to upgrade. I have presentations for staff, for parents. We've been working on protocols. We now need standing orders for hand sanitizer at school. I think I'm on top of all the new rules and regulations. I lean heavily on the CDC, the World Health Organization, Segal and my Board of Health friends. And I also meet regularly with my nurse leader colleagues in this kind of a format, just sort of comparing and sharing tools and resources so that we can be as ready as possible for whichever scenario seems to be the safest one for our students and staff.
Other questions for Jill based off of what she just shared or the list in our packet? Jill?
There was nothing in the packet about outdoors. And I do know that there's some plans for mask breaks and things like that. Is there anything that could be purchased or needs to be purchased for outdoor classrooms, outdoor spaces, anything like that?
So I know Margot has been looking at some outdoor tent situations at the middle school. I think that for our elementary friends, we're very happy usually to sit on the grass, and the teachers make use of outdoor space often. Last week I went to every building meeting for all the buildings in Norwood to talk to the staff, listen to their concerns. Use of the playground equipment is not recommended right now just because it's impossible to wipe it down. And just by virtue of how it's set up, I can't imagine it would be easy to get the separation between the students, since getting down the slide with 6 of your closest friends is usually a big project at the elementary school. If we go outside for mask breaks, I'm sad to say it's not going to be a whole lot of fun. Everybody will have to be 6 feet away from each other. We can't be throwing balls back and forth. Maybe some stretches or some calisthenics or some jumping jacks, but maybe a jump rope. I think that as staff and families start to think about what this is going to look like, it's not going to resemble anything close to what we feel like going to school is. To sit in a desk inside a carrel, everybody facing one way, teacher at the front of the classroom, go outside for recess and stand in your little 6-foot square. It's a very hard thing to contemplate, because it just goes against everything we know and love and understand about educating children. But I do think that this virus is only stoppable if we do these things, if we wear our masks, if we socially distance, if we are absolute bears about washing our hands, using sanitizer, scrubbing things down. But it hurts my heart to think about these things.
I just want to add to that is we're starting to take everything. There's not much stuff in the junior high and the high school rooms other than the teacher's desk and an occasional bookshelf in the student desk. But in the elementary schools, we are taking everything out, basically. Rugs, any of the toys down in the pre-K, because we got to get 6 feet apart and fit at least half of the classes, half of the enrollment in every room. So I just want to second what Jill is saying. It is not going to look like anything we're used to providing for the kids.
Yeah. I think it hurts all our hearts to think about it and talk about it and to plan for it. And this is not a situation any of us want to be in, like nobody on this call or in the district want to be in this situation. Paul, you began to identify, some challenges. So thank you for doing that. Jill, on your end, are there certain challenges ahead that you're, really is on your radar for, whether it's like expenses or supplies or policy protocol?
I think Patty Bortek, who is the new
Grant manager.
Grants writer, has done a perfectly extraordinary job of finding and applying and securing grant monies that are available to help during this COVID crisis. It's a little bit hard because it has to meet technology needs, it has to meet educational needs, it has to meet supply needs, it has to meet social emotional needs, and all of those are going, they're big items and they're tend to be expensive items. I think by the work that she's done, I think we're pretty good financially, except maybe staffing is going to be a bit of a challenge. We have a lot of teachers. I have nurses that have small children. So an AD thing potentially can work for some teachers, but nurses can't work remotely. So, and I'm happy to, I always love jumping right in there and helping out, but I'm only one person and I have 3 nurses with small children. So, if 2 of those nurses needed to be home on Monday and Tuesday, I really can't be in 2 buildings at one time. I'm pretty good that I'm not that good. My sub-nurse list is very small, and typically they're people who work in Boston hospitals, and they are generous enough to give me a day here and there, but I'm not going to have anybody that's going to be able to commit to being there every Monday and Tuesday till whenever this pandemic is over. And I know I've spoken to Dr. Thompson, and he's battling with those issues too, and how we support teachers who have young children and need to be in a lot of places. So that's, staffing is huge. Transportation is huge. It does look from preliminary studies like a lot of parents are choosing to transport their children to school themselves, which is a lovely thought, that then that becomes a traffic issue at the buildings. So it seems like everything with this pandemic, if you fix one problem, you create another problem. So there's a lot of sort of trying to think all the way through the process. So I think transportation is going to be tough. And then I don't even know how to address the issue of eating at school. There is just no, when you take your mask off and you have to be 6 feet away from somebody while you're eating. Paul had gone down to the Callahan, carefully measured things out, and that would, the space that's available in the Callahan cafeteria allows 28 students to eat at the same time. So that school has 230 children in there, so that means we're serving lunch from 9 a.m. till 2:30 in the afternoon. It can't work in the classroom with 6 feet apart because our rooms just aren't that big. So those are my big 3.
Okay. So staffing, transportation, and food services. Just the
Eating.
physical space for eating. Yeah. Okay. Thank you, Joe.
I just like to add too, if you think about busing and Al Bishop, even if we go to a hybrid model, the kids have to have assigned seats. The kids have to have masks on. The bus driver can't ensure that that's happening. So we got to think about, is there a way to put monitors on the buses? Because contact tracing is huge. And if the kids are moving around and not sitting in their assigned seats, and God forbid we had someone get sick, and we had a contact trace everybody, we have to have order on the buses, and we're talking about kids. So I would say, to echo, transportation, especially the school buses, is huge.
Joan, did you have a question?
I did. I have 2 questions. One is around physical education in the gyms. Will those classes be occurring? Or is that too dangerous? And related to that is, I know that athletics has been postponed, but given the concerns around transportation, do we foresee that continuing, that postponement?
On the gym, again, Sigal can answer, but I'm under the impression that we're not going to have gym classes.
Paul, I think there was a suggestion from Desi that gym could occur if the children were outside and 10 feet apart, or inside also 10 feet apart, but not using equipment, using like a they could do yoga, they could do push-ups, sit-ups, they could do activities where you're using your body weight resistance to do something as opposed to what everybody loves, which is ball and tag and running and, you know.
A lot of our gymnasiums don't have outside windows. So, you know, that's going to be an issue.
Yeah, so if I could jump in here, the guidance for the special subject areas just came out the end of last week. We have not fully pulled that aside, but generally we need to have band and chorus outside. We would need to probably have phys ed outside, and it is not going to be playing wiffle ball or anything along that line. It is going to be yoga. It is going to be Tai Chi. I've joked with people about recess being like that. It's going to be spaced power walking. So a chance to get outside, get some fresh air, get some movement going on, but not PE the way we think of PE. So in general, school is the only thing that probably will be similar to in-person school that you do from your childhood is that you will go into a building. What it looks like inside of that building, most of it is going to be drastically different. And I think parents need to understand that, and we need to get that out to students as well. There's a lot of close contact, a lot of, hugging at the younger grades, cool activities that are done in groups. That's not happening. Again, safety is taking precedence over what we know is best educational practice, both on a social and emotional aspect and an educational aspect. So the first thing is to design a safe environment for kids to come to. The next thing is to make sure we're making the most out of our time together. And as Jill said, every decision that we run into spawns 3 others. It's a chain reaction. And with the guidance being as late as it is, it's extremely overwhelming. So that's my 2 cents on that. I'll get more into that during the presentation part of our program.
Jill, I know you shared with us in our packets the presentation that you put together for training of staff. Did you just want to give us a couple highlights of what that is going to entail, or anything that the community should know about the staff training that's going to be going on this fall?
So I had, honestly, Teresa, I had started that with the idea that I was hoping I would be doing it as a live presentation in the fall as part of our sort of welcome back and get to school. So it is a constantly changing presentation because the information is constantly changing. I just really went over the use of PPE, talking about how teachers can set up their classrooms. I think going to the nurse's office has to be very different for many of our students. If they're anxious or they're having trouble settling down, often the teachers will say, why don't you take a walk down to Mrs. Driscoll for a minute? And, just that 5-minute walk and a little, hey, how you doing? How was soccer last night? And all of a sudden we feel much better and go back to class. Those kinds of sort of break visits to the nurse's office are going to be hard. Paul and I are working very diligently along with the principals. We have to identify an isolation area for students who might be presenting symptoms of COVID at school. I think that a lot of the sort of more minor issues that we deal with, hangnails, small cuts, an itchy arm, a broken shoelace, a lot of those kinds of, believe me, when I went to nursing school, some of the things I do in school nursing were not on the curriculum. But a lot of those kinds of things are going to have to be fielded by teachers in the classroom. And then I think that we need to avoid having a lot of congestion in not just the health offices, but also our adjustment counselor offices. I think that this is going to be, these children have been out of school for 5 or 6 months. Just being back at school and being asked to sit in your desk and, no free access to the refrigerator, I think it's gonna be big. And so I think that I'm trying very hard to set up protocols and screening and policy about how we're going to use our health office, how we're going to use our health services, how we're going to use our mental health services. It's going to be very different. Did I just lose track of the question? I think I might have.
No, this was great. Yeah, I was just asking about the training that you were putting together. What would it cover? And you're addressing all the areas that you have to focus on with the staff. That's very different than past school years.
Well, that's one of the ones that I think that's why I went off on a tangent, because I did in the slides, I had sort of let the teachers know that this is, how the health office will have to be used during this time. All of the school nurses in March and for quite a while worked with Sigal and Stacy Lane at the Board of Health and helped with contact and tracing. And so the way we'll handle a sick child in school or a child who calls in and is either positive or is symptomatic, all of that will sort of, working with Sigal, we're coming up with, it will look very much like the contact and the tracing that we've been doing, which is also impactful to education, because if there is a child or a staff person who tests positive, then we have to go out. There are protocols to go through. There are times. So students will be flowing between needing, potentially being at school and potentially being at home, self-quarantining, or following the guidelines that we do for people who are presumed or test positive.
Mm-hmm.
So that's going to look very different too. Paul and I have talked, we're going to do some work too on how we enter the school, how many entrances and exits. Paul has, instead of buying $400 stands and stuff, he's created a lovely alternative for almost nothing. But, coming into the building, hand sanitizing upon arrival, we have plenty of hand sanitizer. I have looked through every order I have to make sure that we didn't get any methanol-based product. So I think, before students touch a whiteboard, before students touch a book, before we're going to be like hand sanitizing kings and queens. But I will say, for a lot of the students, because parents have done a good job talking about hand washing, the school nurses sort of harp on it. Oh, I'm sorry, educate them every year. We're pretty good about hand washing and using sanitizer in general. And that lesson will need to be reinforced over and over again.
Yeah. Thank you, Jill. And a lot of what you're talking about does segue nice into what Sigal Reese is going to talk to us about tonight. But before we go over to Sigal, were there any other questions from the committee or Dr. Thompson, Dr. Wyeth, Lori, anybody in the meeting tonight for Paul and Jill on what they've shared? No? All right.
Thank you,
Teresa,
Jill.
I just want to say that, I'm at work every day and my email is always open. And, if questions, concerns, thoughts, if you are in your school committee role, you hear about something that just seems like a great idea, I hope everybody will feel very welcome to reach out and share, because this is truly a school community project.
You might not want to extend that invitation, Jill. I'm sure Dr. Thompson and Segal can both tell you how many articles and research I've been bombarding them with since March. But if you would like to get those too.
I tell you, I am reading as fast as I can. I am going to as many meetings as I possibly can. But you know, the more you read, the more you learn, the more you share. You never know where the next great idea is going to come from. And I think that the most important message, I guess, that I have is that this is really a community initiative. I know there's some people that, you know, are sort of buying into this. This is kind of ridiculous, but it really isn't. It's science, and we need to sort of pull together as a school community and a Norwood community and do those things that will help suppress the number of people who are affected by this virus, and keep our fingers crossed and say our prayers that some really smart people will come up with some really great ideas sooner rather than later, because this is not the school experience any of us want for any of our students in Norwood.
Yeah. Thank you, Jill. Thank you, Paul. You're more than welcome to stay as Segal, you know, shares the presentation, but I also will not be offended if you have something else that you need to go do at this time. But Segal,
I wouldn't miss Segal for the world.
So Segal, thank you for joining us. I think everybody here knows you, but for those at home, they probably know you too after all your great PSAs over the last couple of months. But Segal is the director of the health department in Norwood. So Segal, you had a brief presentation to share with us this evening.
Yeah, I'll share some slides. I just want to take this opportunity to thank Jill and her team and for their help during the contact tracing. That was very valuable, especially as I share my presentation. You'll see sort of when we hit the peak in the volume of cases that we had at one point. So thank you, Jill, and thank you to your team, and thank you for the schools for allowing them to help us. And like she said, it's a community-wide effort that is going to reduce the spread of this virus. That's the only way to do it. So we definitely all have to work together. So let's see if this. All right.
You're going.
I'm working.
Yeah. Yeah.
Okay. So this slide, I just wanted to start into sort of where we are. I'll start locally, and then I'll pull back and go to the some of the state numbers, because we have to watch both of them. Where Norwood, where each community is on a small scale, you really can't see the large trends of the virus. So you have to look on a county and statewide, but we do track things locally. And as you can see here, we had a very quick rise in March and April of cases. This is the weekly case count by confirmed cases by test date. So you can sort of see the trends, and we definitely flattened the curve, as you can see, through May. And then since the end of May, we've really been to, less than 10 cases every week. With this ends, as far as this week, we have no new confirmed. So those are good numbers. We like to continue to see it. It's going to sort of bounce up and down a little. We expect that, but we just don't want to see that huge spike that we saw back at the end of March. We don't want to see the numbers start increasing like that. I also wanted to show this. Every week, we take the data and we do some analysis on it. We break it down by age, race, gender, and we also include the state data that comes out every Wednesday. So on this graph, I just wanted to point out, this is a breakdown by age. And as we know, as a lot in the news, a lot fewer cases in the younger age groups. I know the numbers are small here, but it's the those 12 cases, and the 2% is 0 cases between 0 and 9, and then the lighter blue next to it is 10 to 19. So 4% of Norwood's cases have been 19 and younger. And then you can see the spread throughout the ages, and as we know, larger percentage in the older populations. So these are the state trends that we look at daily, and they're averages. So a lot of the media reports on the daily case count and daily deaths, and those are definitely valid numbers we want to look at. But I think it's important to also look at all these indicators. We are going to see, the more we test, the more cases we're going to find, which is a good thing because that allows us to do the contact tracing. But what we want to look at is really that that positive test rate. We want to see that stay really under 2%, stay as low as possible. And also we want to see what our capacity out of our hospitals are at. So you might be finding more cases and that case number might go up. Those might be mild cases. They might be asymptomatic cases that we're finding because we're testing more people. So that number by itself doesn't tell us much. We need to really look at all the indicators to sort of see the trend of the virus in the community. So this is something that comes out on a daily basis, and everybody in public health is looking at this report. I wanted to start talking about testing because it's really the first leg we use to control the virus. Test is not a test. There's quite a bit of COVID tests available, and they all don't occur at the same public health response. So they're, as I say, you might hear that somebody is positive. Well, it depends what kind of test they got and how we respond to that. A confirmed PCR test, so the typical nasal swab test, that's going to be sort of the gold standard. That's what we want to see because that means you currently have the virus and you can transmit it. So those are what we call the confirmed cases, and that's a lot of what our data reporting is on. But we also have other tests out there that are that tell us other things about maybe past infection or a large gamut. I don't want to get too much into the detail of it, but a positive test, you need to know a lot more details in order to initiate the public health response that's necessary. So I just want to make sure the public understands that. So when we hear a positive test, usually we need to find out more information. After testing, the three legs we use is testing, contact tracing is the next step. So with that, we take the positive tests and we have them go into isolation. So they are not allowed to spread it even more. And the really important part is that we do an investigation and we find those close contacts. So a close contact of a case would be anybody that had a 10 to 15 minute conversation with them within 6 feet. So that's not always easy to determine, and especially in a school setting, I think that's going to create some challenges. And I think working with the school nurses, the teachers, the parents, the principals is going to be really important when we start to do that investigation to see close contacts in the schools. So definitely that team approach is going to be really valuable in situations like that. Contact tracing, so we isolate the case, we do the investigation, we find those close contacts, we make sure those close contacts go into quarantine. And again, quarantining close contacts is to make sure if they do convert to a positive case, they're already separated from everybody. And that's the way you actually really reduce the spread in a population. What we want to do is we want to reduce that spread to a ratio below 1. And what that means is, so if you have, on average, each case infects less than one person. And that's how you get sort of the exponential decay, or in other words, you get a reduction in your population of the number of cases over time. And we've all seen those tree charts that show, one case leads to 3, leads to 9, and you can see exponential growth happens very quickly. And that, back to the first chart, that's what we saw in March. That was a very fast growth because our ratio of transmission was high. So you want to maintain a ratio of transmission below 1 to see a decrease in numbers. Another big thing with quarantine is obviously compliance, and that's always our goal. So supporting the cases that are in isolation quarantine is also really important. I always say it doesn't get much attention, but making sure people can get their medications or the grocery delivery or, childcare, whatever their needs may be. That's really in sort of the third leg of it, is that we want to make sure that we support those cases so we can maintain compliance with those quarantine and isolation orders. So the next thing I want to talk about is sort of risk reduction. And a lot of this, and I think a lot of the difficulty in talking about this is it's not black and white at all. It's very gray, and it's a lot about probability. It's all about what we can do to reduce risk. And I think we heard a lot of what Jill and Paul are doing. All those activities are risk reduction activities. There are things we can do to reduce our risk of getting the virus, to reduce the transmission. And those can happen on multiple levels. Jill talked a lot about the hand washing, the face coverings, and that's a typo there, I apologize, physical distancing. Also environmental, and Paul was talking a lot about that, cleaning surfaces, air circulation, fresh air intake, designing our space. How can we move the desks around to allow for better social distancing, and barriers? Jill talked about that. And there's also policies that we can do. We see, on the state level, we have the travel restrictions, a sick leave policy that really encourages you to stay home when you're sick. And this is not an exhaustive list. These are just, some of the things we can do to mitigate or reduce risk. But it's really important to know that there's no such thing as zero risk. And you can sort of take this to an extreme when you say, I want to, reduce the risk as much as possible. Of course, we want to do that. But to really do that, you would have to literally be in a bubble. And the only way to have no risk is to never leave your home, never go to the grocery store, never get a food delivery, never talk to anybody. And of course, that's taking it to the extreme. But we have to understand that not all of these tools are going to be able to be used all the time. But what we want to do is maximize the ones that are reasonable for the circumstances. So if we have to reduce one, we want to make sure to pick up another one. If we look to reduce the distance between people, well, we definitely want to make sure we're wearing face coverings and washing our hands and cleaning surfaces. So you kind of bump up the other ones to sort of balance it and take as much risk reduction as you can to reduce that probability of coming across the virus. And sort of mixed in with all that complex information is also the status of the virus and the activity in your community. And we started out with that, looking at, how we are doing pretty well in Norwood and across Massachusetts. So that paints a very different picture of the risk reduction and the chance of coming across the virus. So, we hear a lot about what's going on in Florida. They have very high rates in many other states. Don't want to pick on Florida, but if we were having a conversation of risk reduction strategies in Florida versus Massachusetts, obviously we would want to see a lot more controls because there's a lot more virus and a lot more chance of coming across the virus because there's just more people walking around with it. So you want to bump up your strategies because there's a higher probability you're going to be exposed. So it's all a balancing act, taking in all that information. I clicked on my notes to make sure I brought. Oh, and I also wanted to focus on the CDC has really stressed that the primary way this virus is spread is person to person. And the more we can reduce contact between people is going to be the number one way we stop it. And what I mean is it's less often that we get it person to surface to person. So cleaning and all that stuff is very important also because, again, we want to do everything we can to reduce that risk. But the most likely place you're going to get, the most likely way you're going to get it is person to person spread. And as Teresa sort of said, we have been exchanging a lot of emails. So I really want to thank Dr. Thompson and Chair Stewart for your teamwork and collaboration. We does sometimes, I like how Jill said, Paul's this work husband, but it does sometimes feel like you really get to know each other and we're working really close as a family here to do the best we can. And I want to thank everybody on school committee for really being leaders in our community. It's a difficult position you're in right now. And it's stop sharing here. It's a tough decision to make with a lot of factors about how to go forward. And we're making these decisions all the time. When we talk about, opening the library, opening up the civic center, should we open up the senior center and how should we do it? And what are the controls that we should put in place? And I feel like there's, you're always balancing the risk and the benefits of every decision, and it's not easy. But I definitely would like to give an opportunity for anybody to ask questions.
Thank you so much, Sigal. Questions from the committee on anything Sigal shared or anything that she didn't touch on that you want to talk more about tonight? Maev?
Sigal, I was wondering if you could talk a little bit about the idea of cohort and I've heard people say to me, if all the kids are going to be in school, if there's a hybrid model and you're breaking the school up into cohorts, if everybody's going to be in the building at some point, does it even help to be in cohorts? Can you just talk about what is the idea there and how it would be helpful?
Yeah, so the smaller the cohorts, the better, and it really gets to that contact tracing and what an exposure is. So I think when we look at the elementary schools, I think that's a little simpler where there's less movement of students. But we've had conversations about how can we do it in the middle school and the high school to reduce the number of people coming in contact with each other and sort of creating cohorts in smaller groups within groups. So if we do have a positive case, you're not, all the students don't have to go home, because again, it has to reach that criteria of a 15-minute conversation within 6 feet. That's not going to be your whole school population at the high school, the middle school. It's going to be through an investigation determined how many people that includes. And if we can keep the cohort smaller, it's less people affected.
Thank you.
Other questions for Sigal?
Hi, this is Dave.
Yeah, go ahead, Dave.
So I'm just trying to figure out how to phrase this because, I really appreciate the numbers showing that, like, yes, Massachusetts is, reducing our transmission rates and everything like that. That's awesome. But, we do live in a country where people move, porous borders. It sounds ridiculous, and I'm concerned of somebody coming in from another state that has a high propensity to have COVID. And, I don't want to stigmatize anybody or sound like I'm, misjudging other people, because everybody's unique. But should we come up with a policy to say, hey, if you move from a state that's got a case out of control, should we worry about this?
Yeah, actually, at the end of last week, the governor instilled a pretty strict travel restriction to anybody coming in, even if you're living in Massachusetts and just returning from a high-risk area, you have to do a 14-day quarantine, and it's enforceable by a $500 per day fine. So I think we're trying through policy to address that. I think that's definitely a concern from the governor's office that things are not as great in other states. And, because, for various reasons, I don't think we should get into the reasons why, but that we want to protect what we have in Massachusetts right now and in the region as best we can. And we're going to be able to do it through policy, but also through all those other protective factors, protective things that we can do to reduce our risk. So we want to make sure everybody's wearing face coverings, that everyone's washing their hands, all those things that we keep repeating over and over again. So even if we do get a tick up in cases, we're able to prevent the spread through all our risk reduction and do quick contact testing, contact tracing, isolation, and quarantine, because that's the way you actually stop the spread. So we have, we've bumped up our capacity here in Massachusetts, not only increasing our workforce at the public health local level, but also the state has stood up the community tracing collaborative to assist local health departments. If you can't handle your case number, you can send it to a state agency that has a whole crew of people doing contact tracing. So we have really ramped up the boots on the ground to do the work to really isolate those cases if we do start to see upticks.
I will add too,
thank you. That answers my question.
We've had staff who have been outside of the state and either vacationing or visiting family. And when we become aware of that and speak with that individual, they have absolutely complied with self-quarantining. I think people that are listening and paying attention understand that this is how we keep each other safe. And I've not had anybody give me any pushback. They were like, of course, I'd be happy to do that.
This is a question that maybe we not able to answer tonight, but just any thoughts from anybody in the meeting. So with the 14-day requirement now of the governor, if you travel out of the state to almost anywhere except New England, New Jersey, and New York, how are we, obviously, Sigal, you have a role with that with the Department of Health, but on the school side, I think, Jill, what I'm hearing from you is that staff has been receptive and understanding of that, but what do we do with students? Are we regularly asking that question? Is there a form families are filling out? How do we monitor that? How do we, as a school district, enforce something like that?
I mean, one suggestion, I think we all want to ensure everybody's doing self-monitoring of symptoms. And sometimes it's just those reminders. We all keep saying, don't come to work sick, but kind of that reminder every morning, are you doing a symptom check? Especially if you've traveled. But I think you could set that becomes one of your list of questions that you ask. Have you been in contact with somebody that tests positive? Have you had a fever? Have you traveled to any high risk state? in the last 14 days. I don't know if you can do that every day, but as we talk about different screening questions throughout the community and all businesses, we would probably add that travel question into to sort of try and catch it. But yeah, and a lot of it is what's the word I'm looking for? I'm sorry. Self selected. So people have to admit to it and tell us that they traveled. So that is a large gap in the enforcement. But like
And
Jill
that
said,
is something that I wanted to add. It was in my slides for staff and would be in my slides for families, is that we're going to have to ask people to take an active part in trying to be participants in keeping each other safe, and check your temperature in the morning, ask yourself those 4 questions. And then if you're not sure about your answers, to reach out to your school nurse and let us help you sort it out. For a large number of our students who travel overseas to visit families, often for long periods of time, the families are already used to the school nurses reaching out, because sometimes they're traveling to areas where tuberculosis is still endemic. And so the school nurses are aware that they've been out of the country and work with the families to make sure that they're speaking with their doctors. They're making sure that their families and our school family is protected against tuberculosis. There is a degree of needing to be self-reporting. My understanding from epidemiologists that I've spoken to is that, especially in children, less than 50% ever evidence a fever, even when they test positive. So as one epidemiologist said, the effort of screening temperatures every day is not a good use of your time. We're better doing other kinds of screening measures, following up on families with questions, calling when somebody's out sick, calling and finding out why they're out sick today. But I do think that, again, the big message for everybody is that this is a community effort and a school effort, and let us help you figure out what's the safest way for your child to be at school or participate in programs at school. Let us help you make sure that your family's safe and that our school community stays safe.
Absolutely. Any other questions or thoughts at this time? No. Well, thank you, Sigal. Thank you, Jill. Thank you, Paul, again for being here. I'm sure we will be in touch a number of times as we go forward, but thank you for all your hard work.
thank you.
Good night.
Thank you. Good night.
Bye.
Thank you.
Dr. Thompson, is there anything you wanted to add at this time before we talk with Ann Haley, or should we have Ann?
I can let Mrs. Haley's been more than patient. I wouldn't want to hold her up any longer.
Okay. Well, welcome, Ann. We're happy to have you and to give us a finance update this evening.
Hi. Thank you for having me. Thank you for the invite. And Dave, I just love your meetings. And the length of them, I mean, it's just right. I have nothing else to do with my life. As apparently do you all. But thank you anyhow for having me. We had a FinCom meeting the other night, and I kind of want to share with you folks what had happened during the last couple of FinCom meetings and how the Finance Commission kind of feels about what's been going on, both in the state and the federal governments, and how it impacts our budgets. As you know, we called for some revisions to the 21 budget, the FY21 budget, even before town meeting met. And that was kind of a last minute thing. And we found some areas where we could pause on spending, because we were concerned about how much money we were going to get from the state and how what the impact was going to be on our revenues. So we did that. And then I think it's July 15th, we had John Rogers come and speak to us. And I believe several of you were there. And what John led us to believe is that we wouldn't have a budget until probably October, because the State House is in as much chaos as any place else, and they've got lots of things to do and not enough time to do it all. And so we were concerned about that. And so we had another meeting the other night, and this is a meeting adverse group. we don't like you folks meet every week. But the one we had last night, again, we were addressing concerns we had about revenues. We had Mr. McQuaid in, he gave us a list of revenues. He, no, I can't speak for Tom, but it didn't look dire, but we don't want it to get that way. And we won't know what our budget is until at least October. And okay, no, we won't know what the state's budget is until October. And I'm sorry for saying that we won't know what a budget is. But you know, if the state decides to cut funding, then it will affect the town of Norwood's budget. And it may not affect us immediately because we have money in the bank and we can take money out of the bank and pay for things. But, you know, the money in the bank is there for a reason. It's the rainy day. But we think that, I think the general feel of the Finance Commission is that we are going to be impacted by the state and the federal revenues somewhat this year. How are the revenues being distributed, but also we want to look forward to the next couple of years. We had that override. We expect to be able to spend the override money on wonderful things and programs for both the general government and for the school department, and now we may be just spending it on PPEs and you know, renting vehicles so that we don't have two people in a vehicle, and renting more buses. You get the whole gist. So anyway, we the Finance Commission are quite concerned about this. And in our meeting the other day, we had a vote, and the vote was that we reach out to the school committee and to the general government, the selectmen, to you, Dr. Thompson, and to Tony Mizuko, and we see if that we can get together a group of us that share ideas, share different approaches to different problems that we have, because there are numbers of problems. You guys are one big meeting that is a large problem. So we thought that it would be best if we reached out and maybe the finance chair ask you folks to join us, and we also asked the selectmen and Mr. Mizuko to get together, and there was mention of the budget subcommittee last night or Monday night, but we don't want to start on that level, but we thought that if we sat down and talked and shared ideas, and we know you're going to need more money. But do you know that the town the general government may need more money? And how do we handle these priorities? And we think that if we share ideas and get together on this, and we don't need meetings that last 6 hours, and we don't have to meet every day and that sort of thing, but we need to come together and work together. And we think that we would like to do that with you, and we hope vice versa. So my invitation here tonight is to you, Teresa, and to you, Dr. Thompson, to join us, and we'll meet and we'll see if we need maybe the budget subcommittee to get together or other groups of people, and we develop some workarounds for different problems that we will have.
Thank you, Anne. Anybody on the committee, Dr. Thompson, Ms. Sheridan, anybody have questions or feedback for Anne at this time? Yeah, Joan.
When you're saying the budget subcommittee, you're talking about the budget balancing committee, or is the budget
Yeah,
subcommittee
sorry,
something
budget
different?
balancing subcommittee. That was
Okay,
one
I
of
was
the
just
we talked about.
trying to make sure that we have
Yeah.
that I understood what was going on. And so this is not the budget balancing subcommittee. This is
No,
a separate committee that you're talking about.
this is at the moment. We'd like to start a conversation starting with the chairs and Dr. Thompson and Mr. Mizuko. And if that group decides that we need to expand and to get a larger group or all three boards together, like we did with the policies, that's fine. But we need to start someplace, and I think that's the place to start. That was what we agreed upon last night, was that I would reach out to the others involved and see where we can go with that. Nothing definitive. Okay?
Dr. Thompson.
I muted myself because I am in the laundry room and someone's doing laundry, so it just went off. But
I have some. You can
Yeah.
have mine.
bring it on over. Yeah. So my concern,
Yeah.
and for fear of sounding obstructionist, which I am not, I don't feel that I can have a quality conversation until we finish the work that we're trying to do right now to try to have some sort of in-person instruction. So, and this is going to be kind of a phase. I'm kind of cheating on my slides, but this is going to be kind of a phased approach. You know, there's the family piece that needs to be done and the faculty piece that needs to be done and what it's going to look like. Then there's a whole bunch of nitty gritty behind the scenes. How, you know, and you heard some of it tonight, like how are we going to get kids into the building? That's
Mhm.
not necessarily something that is a cost-effective piece, but those are all pieces that need to be completed in less than a month. So
Yeah.
right now I am having a very difficult time because it is a large district. It has a lot of moving parts. It has 9 buildings,
Mhm.
you know, and because it is spread out, there's a lot of different pieces to it. You know, managing that and the communication between all of those is a constant, consistent challenge. So I'm not sure I could have a fruitful conversation until probably after Labor Day. So I'm being completely honest with that. I don't know as if we're going to know costs. The commissioner today was enthusiastic that the federal, next round of CARES or COVID relief was going to be done in the next 10 days. I'm hoping he's right. That might ease some of the things that I would bring to the rest of the town, but still I need to figure out what that funding is, what funding we have, and where it all fits together before I can have a conversation about really anything else. So that's my struggle at this point, and it is a struggle. I've spent every moment except for 1 hour in this chair, including breakfast, lunch, and dinner. So, you know, 12, 14, 16-hour days, and I cannot honestly do anything else. And there's things that I need to do that I'm not getting to. So that's my concern with that. I'm not sure I have any good ideas at this point. And I'm being completely honest and open with you, as I always try to be. But we're not going to have, it is like working in quicksand. We take a step and all of a sudden that starts sliding away. So it's very hard for me to say, we're going to do this and we're going to do that. And we need this and we can give up that. Because it's.
And that's not necessarily, you know, the conversation should probably start with what is everybody's needs. And we know the needs are shifting, but if we have an idea, that would certainly help.
Yeah.
And, you know, we'll a start.
Right.
Okay.
Right. And my understanding today is that a House 1 budget did come out.
Oh.
That was news that I got from a colleague that the House had put out a draft. Whether it's been voted on or not, I don't know. But there was a draft that came out with level Chapter 70 and extras in it. So, we'll see. I did not have the time to check on any of that. That's just what I heard. I could entirely be wrong, but maybe October is a little more pessimistic than it is. There was also talk about having a budget for the first third of the year. So that might be what that was too. So
Yeah.
Dr. Thompson, what is the latest on the Student Opportunity Act? Is it still the August 15th deadline, or
we have not gotten any updates, but basically the commissioner is really not interested in having us go through the rest of the process to put the form in until we know whether there's funding for it. So seeing that probably is not going to be before the 18th of August, I'm actually waiting for him to tell me when it's due as opposed to tell me when the date is.
Okay.
So.
Yeah.
Okay. All right. Just keep it in mind. I guess that's a no.
Well, it's not a no. I just don't know that I can
Okay.
commit to being, if you're talking about having this meeting between now and the end of August, I am not sure I can commit to actually being there. Not that I don't want to be. I just don't know if I can commit to do that. So I try very hard not to make promises that I cannot keep. But again, unfortunately, I'm in a extremely difficult situation. My staff, is in an extremely difficult situation. Parents are in an extremely difficult situation. They need to know what the heck we're doing and how the heck we're going to do it, and that's got to be number one priority.
Okay.
So.
Fine. Teresa, is there any opportunity for you to meet with us and go over some thoughts?
I can meet as long as the committee is okay with me doing so in my role as chair.
Okay. Well, you folks can discuss it and then decide and let me know. And I will relay it to our committee, and we will continue and reach out to the selectmen at the same time.
Okay.
All right.
Thank you, Anne. Have a good night.
Thank you for having me. I'm going to stay and watch a little longer.
Okay.
Okay. Glutton for punishment, Anne.
Pardon?
I said, are you a glutton for punishment?
Yeah, probably. Look where I'm sitting.
Although tonight should be much, much shorter than last week's
Okay.
5.5-hour meeting. But on that note, Dr. Thompson, your report and update is next on the agenda. So
Yeah. So I do have an announcement they're going to make at this point. It is bittersweet, but Mrs. Robbins has resigned from her principal position at the Willett Early Childhood and Little Mustang Preschool Academy. We're still working out when her final time in Norwood will be, but we're going to be looking for an interim person to fill in that position for the next year. So one more thing on the plate, but I do want to make that announcement officially to the community, to the school committee. I believe that she told her staff yesterday, and I was going to be notifying parents this evening as well, but I want to make sure everybody knew that. So my plan for this, because I am going to ask for a vote for our submission to the ESE and our feasibility study, was to actually start with the slideshow, and then that hopefully will answer some of the questions that maybe are in the form that was shared with you earlier this week. So let me, oops, I guess I have to say presenting first. So let me know when it looks good.
you're good.
They're good. Okay. All right. So with that, this is update number 2. as we said, and today's date, we push the right button. Here we go. So again, kind of a revisit, and these challenges are the same as they were last week rather. Seems like last year sometimes. Balancing, the health and safety of our students, staff, and community with the educational needs and the family's needs to have kids in school. The lack of timely guidance, and I think probably the best example is the bus. The bus guidance we got last week at 10:22 last Wednesday evening. And to give people kind of some idea, if you're rerouting buses, that's usually a 2.5 to 3 month process. And that's without any strange constraints. So we got that, the middle of July, looking at a September start. So 6 weeks to do 12 weeks worth of work with totally new guidance and constraints. So it gives you, that's just a snapshot of the challenges that we are trying to sort through as we go through this process. Obviously, the fiscal constraints and the uncertainty. We have received notice and, as I mentioned last week, applied for the grant through the governor's office for the extra $225 per student. And we're still waiting to hear on federal relief, as I mentioned just a few minutes ago. The physical limitations of our buildings, and I think that Paul described and explained that much better than I could, but now those are aspects that we are working within. Transportation questions and planning. So we can only transfer 24 children on a bus. The normal, a full bus is 71 students, so it's about a third. And there is, I'll be quite honest, there's no way within the time frame that we have that we could transport 100% of our students to school as we have with the current constraints of 24 students on a bus. And obviously the safe operation of our facilities and making sure that those are paramount, because we do not want to have exposed children or staff and their families to any of this pandemic. So disclaimers. So, my new saying is we're trying to fit a square pegs into round holes. They do not fit well. This is not how you're redesigning an entire system. And as you heard mentioned a couple times earlier, each time we have an answer, it raises 3 or 4 more questions. We are working on our opening model. We will likely have to revise that model as time goes on. And that's what we're looking to open with. That does not mean that will be the mode or the model that we are in for the entire year. And I'll get a little bit into that as we go forward. But that we are trying, because the numbers are low, although I just saw the state numbers and we're over 350 for the first time since the middle of June. And there's been a constant uptick over the last 5 to 7 days. And it's getting a little concerning. So there is entirely the chance that if this goes out of control, and I want to remind people that the spreading of this virus can take off and it compounds. It's an exponential growth scenario where you can go and all of a sudden the numbers do not support face-to-face. So this is an important piece. Whatever we design now, if the numbers are different, we might not be able to use that, which is why the state has asked us to come up with 3 models: a full in-person, a hybrid, and the full remote. And lastly, there are no good solutions. You heard me mention, and you heard it mentioned earlier, that these are not the best practices, the best things for kids, the best things for staff. We are prioritizing safety first and following the protocols to make sure that safety is the first thing. And school will look very different. There's not going to be group work. People are going to be sitting in rows, all facing the same way. Recess is not going to be fun playtime. It's going to have to be some sort of organized fresh air and exercise time. So you're not going to be able to necessarily, you're going to have assigned seats on the bus. You're going to have to wear a mask all the time. There are going to be definitive differences in school when we enter in the fall. So process update, as I mentioned, we did get some important guidance last week. We got bus facilities and safety protocols. Today they just came out with career technical guidance. There is more revisions and guidance coming out over the next week or so. We have begun working with our unions on areas of concern and trying to communicate with those. We had our first meeting with the Teachers Union today. We have partnered with the Parabola Project, and that is one that is being shared across the state. But I shared that document, with the committee last week. But that is an organization, a philanthropic funding project to help schools go through the questioning about safety protocols. And we've been working with that for the last 3 or 4 weeks. Oops. So we are now involved in a deep dive into staffing, scheduling, transportation, and lunch. All of those things are limiting factors for how we would run school. We're still waiting for funding information from the federal government. The DESE has agreed with the statewide teachers unions to only hold schools to 170 student days. Teachers would still work a first year, but those first 10 days would be focused on training, logistics, curriculum development, and that will change the student start day. We have not exactly figured out when that will be, but it would be sometime around the 16th of September, either slightly on the 16th or slightly thereafter. But please stay tuned on that. All right, so the feasibility study. So, the plan that is in front of you, or the form that we are filling out, is essentially a feasibility process. We were asked by the state to look at the 3 models and to go through a study of what it would look like and what our limitations were and what would happen. So an in-person, 100%, or all the kids coming to school, we simply do not have enough space in our buildings to do that. We do not have enough transportation capacity to do that. And I will remind people, and I know someone mentioned bus monitors, and we have had that discussion, at least preliminarily, with the bus company. But, and right now the economy is on the downturn, or is not where it should be. But previously we've had trouble finding people to do those sorts of jobs. Maybe with the extended hours, it might be a little easier, but again, that comes with a cost. Hybrid, we are trying to get as close to 6 feet as possible. So it will be a partial in-person, partial remote model. Remote, it basically is the easiest to achieve. It does not involve a whole lot of extra expense or squeezing but it does not work to solve equity or engagement issues that we've seen this year. So part of the reason why the Commissioner of Education and the Governor want to see face-to-face instruction is because of the equity issues that has been noted and seen in our vulnerable population. So, and as the Governor said a few days ago, schools will need to be able to pivot between these models on a moment's notice. So hybrid. So we are basically exploring as a main recommendation to the community and to the school committee a hybrid model. We are looking to have consistency across the district. We are talking about 2 cohorts of students, a gold and a blue group. So Monday and Tuesday would be in-person, face-to-face instruction. Wednesday through Friday would be remote. The blue cohort would be remote Monday, Tuesday, and Wednesday, and then in-person on Thursday and Friday. So Wednesday would be remote for all students. Teachers would do not only remote teaching, but also for half the day, and then the other half of the day would be professional development, collaboration, recalibration for that second half of the day. Students would have remote work to do, so they would be doing a full day, but the teachers would be doing other things during that day. There would not be, or the majority of our students would not be in school, which would allow for, as we affectionately call it, the deep clean between the 2 cohorts. Again, that safety issue. At the hybrid, it would be a little bit different, and part of that is trying to get in-person instruction. Remember, they have a rotating schedule. They have many more sections of different classes and levels and things along that line. So, and again, this is still up for discussion. It is still being researched at this point in time, but what the early model is looking at in-person instruction for part of the day, and early dismissal on Monday, Tuesday, Thursday, Friday. And they would have synchronous or at the same time remote sessions in the afternoon. Full day remote sessions for all on Wednesday, again, trying to mimic the same schedule that we see in K through or pre-K through 8. Grab and go lunch would be part of the process. So they would take their lunch home, solving one of the lunch problems. What this does, it actually maintains the integrity of the high school programming and schedule, transcripts, all of that sort of thing. Student schedule choices, allows for a student support block and checking in and with students, common planning time by department, which is going to be necessary in a fully remote model. And again, as I mentioned, this being able to pull this off depends on how the transportation would fit in with the rest of the district and the lunch and whether that is a viable option. So that is what we are looking at. And again, the hybrid is what we are examining full-time as our preferred method of attempting to reopen. So we have challenges with this model because of the guidance and the restrictions. So transportation, we're going to need multiple bus runs. That is going to increase costs. There's going to be cleaning of bus seats and that sort of thing. Time differential. If we have to do 2 runs in the elementary, we can't have all the students, will not arrive at school at the same time. How do we handle that? Staffing. We're going to need more staff to teach and supervise. We're trying to limit that at this point in time, but probably at least a couple more teachers per building. Lunch, space and lunchrooms. You heard the discussion of the Callahan. So how do we do that? How do we serve that? One idea is to maybe have desks in there instead of tables. Funding is an issue. Right now, we're looking at extra $225 per student. It's still short of these other challenges, and you will hear money be one of them. The other challenge I want to mention is the Crookley Middle School interior rooms. We did, and again, working closely with the Board of Health, looking closely at the guidance from the state. We really should not, could not, will not be using those interior rooms. And that's about 3 to 5 learning spaces we need to replicate in a way. So we are investigating options there. And again, this comes back to another piece we don't have the answer to yet. Hopefully we'll start next week, but it's how many families will opt for a remote learning academy experience as opposed to in-person instruction. So if that number is lower, maybe it's only 1 or 2 classrooms we have to replicate. If it's not lower at the middle school, it might be that 3 to 5 range. So again, there's still questions we are not going to be able to answer until we really get final numbers from various sources. So I want to talk a little bit about the Remote Learning Academy. We are required by the Department of Elementary and Secondary Education, DESE, to give parents a choice of remote-only learning. So they would choose to have their kids do remote learning, not necessarily go into school. So basically, parents will have a choice. The choice is to follow where the district is, be it hybrid, be it remote, be it at some point, hopefully in person, or to join the Remote Learning Academy and do remote learning. So this is set up for several reasons. One is students who cannot attend, and that might be a medical issue, might be a medical issue in the family. Families are uncomfortable with in-person models for various reasons. People in the Remote Learning Academy would follow the same curriculum and expectations that we've been designing over the summer. We will group students into classes from the entire district. So first grade would include students from the Prescott all the way over to the Callahan. And we will be asking parents to sign up for that option probably around the week of August 12th, maybe even the 10th, depending on when we can get to that point. So, oops, I'm sorry, went too far. And again, I want to mention that students with significant special needs, and these would have them identified in their PL3 section of their IEP. For the most part, it comes down to substantially separate those in specialized programs in our schools, or have a very high level of therapeutic need. If there are students who are English language learners and have a learning disability, they would come into this group. And we are also looking to expand options for our lowest EL students. But again, staffing and organizing are pieces in that. So these students with these significant special needs were required by DESE to offer them a 4 or 4.5 day a week program. So that would run concurrently. And that, that's separate from whatever model we get in. So we could theoretically, yeah. So I won't even hypothesize on that. So for families, I need them to know at this point in time that we are looking at the hybrid model. Right now, the hybrid model is about 5 to 6 feet of distance, depending on how many are enrolled in a particular school and the size of the classrooms in the school. We are looking at 2 days in person, either the first part of the week or the last part of the week. Wednesday would be fully remote. You would need to decide whether your child is going to be doing what the schools are doing, which we are hoping is going to start in the hybrid model. It might, if there is a spike in the fall and a second wave, as we've all heard about, be going into all remote. So we need to decide where you want or your child think your child should be and apply in a timely fashion to the Remote Learning Academy. If the answer is no, you do not want them in an in-person instructional model. The other thing is with those 10 days that the Department of Education negotiated with the teachers unions, so the student days are likely to start around the 16th of October. 16th of September, not October, September. So just kind of keep that in mind. That's just a guesstimate at this point. We still need to have discussions around that, but just to give people a heads up, we're not looking at starting on the 3rd or 4th of September at this point. Extended day, a lot of questions about extended day. And again, working closely with the Board of Health, we have concerns about extended day happening at the Savage because of mixing cohort groups. So think about it. You have all these kids from different cohorts at different schools getting on buses and all coming to another place. If there was some sort of infection, that again, increases the contacts, increases the spread, and again, trying to make sure these numbers stay low. So with that, we're still researching cost and viability at this point. We need to keep these groups small and we need to keep them distanced just like we do in the classroom. The numbers that we can handle might actually differ depending on what we find, and we are looking at offering those at the elementary school. So if you're an extended day student and you go to the Callahan, you would do extended day at the Callahan. But again, that is a staffing question, and especially around custodians. So that day might be shorter than it has been in the past. We're not quite sure yet. That is another area that we are exploring. And we are probably only going to be able to offer, because of the numbers and the space problem, we are probably only going to be able to offer that extended day on the days that you would be going in person. For the same sort of reasons we are talking about with the mixing of cohorts at the Savage and that sort of thing. So I think I've kind of covered that. All right, so the work continues. We have begun working on a memorandum of understanding with the Teachers Union. This obviously represents a change in working conditions on multiple fronts. That conversation has begun. Transportation planning and cost analysis, we need to figure out that. Next, we'll be figuring out how we pay for it, especially if the federal money is not coming through. Staff impact in cost, we're looking at several different models for staffing, trying to keep our costs down. Continue to work with the Board of Health and Segal on our protocols, questions and interpretations of what we have seen in guidance and comparing that to her expertise. Obviously, lunch operation facility issues are ongoing and how we would solve those. The 10 days of, the 170 instead of 180, those 10 days of training, we need to figure out what those are going to be consist of, but they will be first and foremost about safety, about protocols, about procedures, about curriculum and things along that line. Scheduling, how do we schedule the building to maximize the learning time? Will we have shorter classes? And again, that issue of 2 waves of students arriving, if that's what we end up going with, is that something that influences the scheduling? Another option might be to have different elementary schools starting at different times as we can get to them, which is a whole nother ball of wax. Okay, so student placement of those opting for the remote academy, the numbers in the remote academy will impact what our distancing will actually end up being, and how many we can actually put into a particular school. So, the one thing that I will mention here before we get into questions is that, so again, the governor of the day did say that he's expecting schools, the planning is important, so schools might need to pivot into any one of these models at any point in time. So there is the chance, or the likelihood, if you will, that we will have some sort of question about someone's health, and that we might have to close a classroom or close a school. It would not necessarily be the entire district. We would try to close as little as possible until that contract tracing is involved. There might be, quarantines imposed where we would have to pivot to a remote model, which is why last spring we started discussing and planning for a model of instruction and curriculum that would work in multiple models so that we can easily pivot between. So with that, I will take questions and go back and unshare my slides here. Oh, am I back? Is it gone?
Yeah, it's gone.
Oh, good. All right. Yeah, that was weird. I just stopped it on the Google on the tab, and it just stopped automatically. Meets. Isn't that cool? All right. Thank you.
Dr. Thompson, I have 2 questions for you.
Yeah.
Around the Remote Learning Academy, I know Desi has said needs to be available and families can opt in and out. And I know that you have shared on a number of your Facebook Lives that we would need notice. Obviously, a family can't call on a Monday and be like, okay, my kid is coming back tomorrow on a Tuesday.
Right.
And I'm sure a lot of this is still being worked out, but do you have a sense of how much notice we would need from families? Either if a family decides to start remote, but then maybe a couple months they want to have their kid back at whatever model we're doing, or vice versa. If a family did not tell you by August 12th that they want to do remote, but then hypothetically, if cases get worse and the family's just not comfortable with it anymore,
Right.
When could they choose to then go remote again?
That is a very good question, and we have not even approached that one because we haven't fully figured out how many kids we have in remote. I would guess, I don't want to use the word assume because you know what that means, but I would guess that it would be easier to go into the remote academy than it would be to come out of the remote academy, because that would involve rearranging a school classroom, creating a assignment, a bus pickup. So back to buses, we have to have assigned seats. We only have 24 on. So if someone opts in, we might have difficulty arranging transportation for them. So there's a lot that goes into that, going from the person to person model that we're working on, whatever it might be, to remote learning academy. Conceivably would be an easier transition and faster couple days. Other way, depending on how many, it could be that kid, there's not a space problem in that particular grade level at that particular school, and it can happen pretty quickly. Other schools, it might be a process to try to figure out how to do it.
And Desi hasn't given you any guidance, correct, on how to determine these details, just the blanket statement of you need to offer it to families who want it, correct?
Right, exactly. So, and we are held hostage to the effect that the people who are making decisions about what schools should be doing are not necessarily people who have worked or led or taught in schools. So I think that we have figured out that that schools are much more complex than people generally think that they are, and that this is not an easy process. So, you know, you're getting guidance. I mean, the first one was when the CDC said that students were going to eat in the classroom, and I nearly fell out of my chair because there's 6 foot distance in the classroom is going to be difficult. And how is the teacher going to be in there and having their duty-free lunch at the same time? So these are all great ideas in isolation until you vet them through somebody who's dealt with the multiple aspects of running a school system or a school. So.
My second question on a different topic, with the hybrid model at the high school, when you were mentioning looking at the proposal to have like early dismissal, are we still, I know a lot is going to be dependent on transportation, but do you have an idea of how early? Like, what are we talking about? What time would the students be getting out?
Alec, I have to pull that. I have to try to pull that up. It is here.
I believe it's 11:45, Dr. Thompson.
Yeah. Okay, thank you. I was going to say 11:30. Somewhere.
So they would still be, if transportation allows, starting around 7:40, going to 11:40.
Right.
Grab and go lunch.
Yeah.
Home. And then what is the expectation once they're home? How many hours?
They would have 2 or 3 synchronous classes in the afternoon.
They'd be back on at 1 o'clock, mandatory attendance at 1 o'clock.
Right. And that is a change from the Department of Elementary and Secondary Ed, is that attendance is to be taken, students are to be in class, classes are to be happening much like they would, and grades are going to be given. So, you know, when we first made this shift, it was totally like being in an alien Martian type environment, and people were not prepared for it. But the expectation is at this point, people should be more comfortable with it, and it should be more like regular school. That also needs to be balanced with how much screen time a young child can actually take in how long of doses, but there should be regular person-to-person screen-based instruction. So
if they're back and required online by 1, the school day ends at 2:23 or whatever the current time is, or
2:30.
2:30. And this probably opens up a whole other can of worms that we haven't gotten into yet because we're still waiting for guidance. But let's just say the MIAA does say we're running fall sports.
Yep.
But now all of our students are home.
We actually talked about this. And Dr. Galligan mentioned that even when there's a half day now, students go home and come back. He also talked about the fact that they were open to the possibility of having spaces in the buildings where they could safely have student athletes stay to do their remote learning. But he said there were a lot of what ifs and that we would sort of cross that bridge when we got there, but they were thinking of all of those things in their planning.
Okay.
Right. The commissioner did say today that he was of the mind that fall sports may be canceled, but that's still under discussion.
Yeah, I know right now the MIA is looking at September 14th, but not to always be the little black rain cloud, but I wouldn't be surprised if that doesn't happen.
Yeah, and it'll be interesting to see if there's some sports that are allowed to happen, like golf. But then again, if you're only running a few, then you run into Title IX issues as well.
Other questions from the committee on the presentation? Anne Marie.
No, I just wanted to follow up on, am I muted still?
Oh, you're good. We can hear you.
Okay. my menu didn't pop up fast enough. I just wanted to follow up on your first question and just kind of reiterate that I think with the remote learning and the in-person, the hybrid model, I feel like, for lack of a better term, that we should probably plan on something like an add drop period, not implementing one, not what I'm saying, but almost expecting one, where, students and families will try something they thought was a great idea, and two weeks later, it's the worst idea for their family. And I think we're going to end up with quite a bit of that, unfortunately, in the first 2 or 3 weeks. I think if that's not already in the back of minds, that it might want to be
Mm.
to the front of minds, because I think that's a real possibility.
Yeah.
And and depending on those numbers, depends on how close we get to the 6 feet. So we've already lowered the class size in the high school to try to accommodate, that where we are. But it's difficult because we don't have extra classes as it is at the high school. It's very, very tight schedule. So do you not give students the possibility of doing the coursework they want to do to prepare for the next part of their life, or 6 feet? So we're looking at a 50% capacity in the high school. And does anyone remember what the spacing right now, if we don't have remote learning folks, is at the high school? I want to say 4.5 or 5, something like that, between desks.
I think that's right.
So it's, but if there's less than a class, we can take out some desks and that distance gets wider. So, so it's, again, square peg, round hole, no great decisions. There is, part of why we were able to do what we were able to do in the spring is that you did have relationships that had already been built. And part of my concern is starting without building relationships. And relationships are central in learning and what happens in school. So, and I'm just nervous if we don't at least start or make some progress in there. It's going to be difficult. The idea of the hybrid model is that by definition, because you're going to be coming in and seeing your teacher, the level of engagement right there it should be raised. So, of course, the ongoing question and the elephant in the room is how long can we stay there? Will our numbers stay low, and will that be the model for the entire year? I can't guarantee that. So parents need to understand that as well. Just because we say we're looking to start in a hybrid model doesn't mean that our virus count and infectious rate goes up, and we're looking at a remote model at some other point in the year. Or I'll bring sunny skies here. Maybe our good neighbors and friends, Moderna, get the vaccine off and running. It's there's millions of doses that are going out weekly, and by May we are in something close to a full remote model because we don't have to have tiers of transportation, and we can put people in the classroom. So we'll still probably be wearing masks, but that's a little more towards what regular school once upon a time looked like.
Yeah, if I may, just Anne Marie, I think the high school has always had an add drop procedure in place, and guidance really does everything they can to make sure kids' needs are met. I think, however, I think parents need to be very realistic about what is possible under these new circumstances. So there are going to be many people who might like to drop something or add something that simply will not be doable because of all the other restrictions. So I think we need to be very cautious about that.
I think I was thinking more along the lines too of just remote versus hybrid add drop. So, some parents may decide to go full remote thinking that's the best for their kids, and it's just not working. They can't, it's not working at home. Or even I'm thinking more on the flip side, kids go 2 days a week and realize this is not working for my child, or the health status change in the house and they want to flip over to remote, which obviously would be easier. But I feel like in the first 2-3 weeks of school, like there's going to be a lot of moving parts with parents deciding what actually is working and what's not. Facetiously called it an add drop period because I feel like that's what it's going to end up kind of almost being like, and just want to make sure that we're cognizant of that and making sure that we are prepared for some major changes across the entire school community in those first 2 to 3 weeks. I'm hoping not. Hope everyone makes the right decision.
Yeah, with you.
Yeah, I've been following I really like research a little too much. I'm just going to put that out there before I tell you what I've been following. I've been following districts not only in Massachusetts, but in some other states. And I haven't seen this in Massachusetts, but what I did see some districts doing in Pennsylvania with this whole remote versus following the model of the school is they were telling families you had to commit to a certain period of time. So some districts were saying a 3-week period. And another district I saw, it was a whole grading period, a whole semester. So in alignment with what, Anne Marie is talking about, we might want to think about that more in between now and August 10th. Because, so far we said you can change your mind. And, Dr. Thompson, you and Lori, you were commenting on the Facebook Lives in the section answering people's questions that, yes, you can change your mind, but you have to give us notice. So I think we do need to define what is that notice. But Maya?
I don't remember where I read it. I thought it was in one of the DESE guidance documents I had read. I thought that they had actually addressed that you could establish some sort of period. And I think they said they didn't want it to be more than 3 or 4 weeks or something. It was a pretty long time that they were saying that if you had chosen to go remote and you notified the schools that you wanted to come back into their in-person hybrid model, the schools could tell you yeah, we'll make space for you in 3 weeks or something like that. And we can look into what exactly the number was, but we do not want to be sending the message that you can change, you can bop back and forth on a weekly basis. And I don't think anybody's saying that, but I think the idea is, we're looking for people to make their decision. If there's really some reason you need to change, this decision isn't set in stone, but this, obviously there's a lot of planning that would have to go into bringing a child back into the schools. And possibly even to adding children to the remote classrooms.
Right. Yeah.
There's probably just as much going remote, just because you may be in a different place remotely with that teacher. You may, there's a new dynamic to get used to there. So I think, remotely could be just as difficult to pop into and out of. And I think that's kind of where I was going with the comment. I'm not suggesting we should just allow everybody in, this first 3. I was just saying that with no guidance, okay, you got this much time, you have to make your decision there will be a lot of, oh, this is not working for me. This means switch.
Yeah.
Yeah. Other questions, comments on the presentation so far? So, Dr. Thompson, you need us to vote on the form, the actual form that you packet, right?
So if you, I don't know if do you want me to share that so the whole world can see it, or?
Yeah, that might be helpful so people are clear on what we're voting on.
Yeah, I will do that now because I have a tab open. Let me try to pick the right tab. All right, so so this is and I did share this with the committee, I think on Tuesday. We did finalize it Monday. Sorry, scrolling to the top. So it has 2 parts. So this 31st is actually a feasibility study looking at what we did and reporting out our findings. So you can see that, looking at the feasibility study, preschool and kindergarten would require additional furniture to be able to maintain physical distancing. In order to implement full in-person, the district would also only be able to provide 3 or 4 foot desk separation. And that's after removing all the extra furniture. And I think you heard Paul mention that earlier. We don't really have overflow sections. And again, unless we're not going to have a gymnasium at all or a cafeteria, which then becomes problematic. We did survey staff, we did survey parents. So staff indicated that 35% were not comfortable with coming to work with 3 foot social distancing. That's a significant number of our staff, and that was early on in this. In addition, our family survey showed that 20% were not comfortable sending their kids to school with 3 foot social distancing. And then all of our neighboring districts are kind of go with a, part of the week in, part of the week out sort of hybrid. situation, and the transportation of 24 students at a time would basically mean we'd have to have 3 rounds of buses for each tier. So that takes our 3 tiers to 9. So it's cost prohibitive. So then we go through, looking at that model. What would we look at? So it appears the best option at each level would be preschool for an in-person with a reduced number or perhaps no peer models. We would need to talk with the department about that model. That's not a normal model for preschool. Elementary, middle, and high school, again, I described that are these, A part of the week, B part of the week, or blue and gold cohorts, with Wednesday being a half or full remote day. That might change over time. As the year goes on, we might change a little bit of how Wednesday actually works, but that's kind of where we're starting from. So part 2 is a summary of the reopening models. So that it really is kind of redundant to what what I mentioned earlier. Elementary, again, it's that lack of space in our elementary schools. There's little room to spread students out. Middle school, we have 12 classrooms that are interior rooms. And we would not be able to bring all of our students back and not use interior rooms. One of the solutions we discussed with the maybe needing 3 is maybe to have some sort of tents outside for those rooms at the middle school in order to do the hybrid model. And part of that is it would be easier at this point in time, because this is one of the suggestions. Well, if you need to get portable classrooms, get portable classrooms. It's not quite that easy, and the portable classrooms are not that big either. They tend to be rather small, and there's a whole bunch of setup as well as expense. But maybe starting with some sort of tent-like structure and then transitioning to portables, should we be able to maintain that before the cold weather comes. The high school is unable to accommodate a full classroom in-person model because we would, in a lot of cases, kids would have to be closer than 3 feet. And this goes back to the MSBA building requirements and specs to make sure we're maximizing space and lowering costs on a statewide level. Well, that does not include huge classrooms with extra space in it. There's just not enough space in a high school classroom to accommodate, the students who are applying for it. So then you have a choice of not having students getting their classes. So special education, and again, I mentioned before, we do have to accommodate an in-person programming for the full week, if you will, for special education. And we are working with that. Some of those spaces are large enough it's not a significant concern. I think we've talked about the hybrid model in detail, although the preschool, again, is not looking at the hybrid model simply because it's just going to be very, very difficult. And if you're already going in 2 days a week, how many kids are going to opt for 1 day a week? It's just problematic. The kindergarten would follow a 2 days in person, 3 day remote sort of thing to start the year. And we're still working on whether that's homeroom split in half or the homerooms are in, homerooms are split in half or half the homeroom are in person. That's been going back. I think kindergarten is leaning more towards the whole homeroom being there, but that's something we still need to discuss and investigate. Elementary, I think we've talked about that. And basically the 2 models are, the staff, a teacher teaching their whole class in multiple rooms for 2 days, or whether half the class is coming in for Monday, Tuesday, and the other half coming in Thursday, Friday. Middle school would follow the same sort of things. They would be spread into adjacent rooms. And once you get into the middle school, it gets a little more in depth as far as scheduling and planning and staff assignment, because you have people that are English majors teaching English. So and you can see in this plan right here, We had originally talked about using interior rooms with fewer than 10 students. That's a change I'll need to make in this part right here. Let me just highlight that so I don't lose it next time, because we just figured that out with Segal earlier today. And we're looking at rotating kids through lunch, eating outside in order to do that piece right now. You can see the high school schedule there. So they're going to rotate between in-person classes and synchronous classes throughout the day, and different days do different things. The hope is that they will meet at least 3 times, 1 in person, 2 synchronous during that week. And again, there is that project-based piece to the curriculum. Special ed is special ed. It's kind of repetitive in here. Okay, so full remote, and I'll be honest with you, we've already done this, so this is kind of been there, done that, but it does not particularly include extra staff. But my penchant or my directive has been to whatever we build, we're able to move from one model to another without having to take time off or deep breaths. So if we have to close an elementary school or the middle school for a couple days until contact tracing is done and deep cleaning is done, they can quickly and easily move to remote right away. We don't have to reassign people or figure things out. If there's a second surge, we can quickly move to remote without having to reassign kids and shuffle the proverbial deck. But this obviously is a little bit different. The one thing you'll see in this piece is that we have invested in some software to assist with the work that we are talking about, including an enhanced Google product. Seesaw, Alec, you want to talk a little bit about what Seesaw is real quickly? We'll come back to Alec on that.
Seesaw is sorry about that. Seesaw is a software platform that allows kids to collect their work, demonstrate their work, present their work. It also allows parents access so that they can see the kids' work and actually comment on it. The teachers can write their comments into Seesaw as well. So it's really like a portfolio of student work, but it's highly engaging for kids, and it has multiple means for them to communicate what they've learned. They can draw, they can do a video, they can, write some text, just about anything, So.
Okay. So the middle school and the high school basically used a pretty synchronous model during the spring, but they would up that from what they did last year. And then we get into our high needs students. So special education, we're talking about in-person programming. And that is the model that we're being asked to produce. A little detail in there about B and C grids for the in-person. And basically that model doesn't really change for that population. In the in-person or the hybrid, should we go through a situation where the schools are closed or forced into remote, then you would see we go back to this instruction and service modes of delivery. Lori, do you want to expand a little bit on that? Are you still with us?
I'm here.
Okay.
I'm here. So in the spring, we were encouraged to kind of take 2 approaches to special education services. And one was sort of the more providing teleservices. So as it says here, Dave, where are you? Sorry. So talking about providing more services through actual servicing, in-person lessons, through Google Meets, those sort of things. And then there was another form of providing services, which was sort of providing lessons and activities that students could do at home that weren't teacher driven, that were not interactive, but were just activities that could continue on skill building independently at home. The state has taken the stance that moving forward, should we have to go to remote instruction, we will be going with more of a service and instruction model, which means that it will be more engagement, more interaction with service providers, more Google Meets, those sort of things. And we are only allowed to stay within a sort of the providing activities and whatnot for a 2-week model is the longest time in which we would be allowed to just provide activities to meet the special ed service provision.
So then we're also required to offer similar services to English language learner students who are also special education students, and we still need to crack that nut. But that is that again is going to be a staffing issue, because most of these students, although they have individual education plans and are special education students, they pretty much are getting their servicing in the regular classroom. So we're still we're still trying to figure out exactly how many students those are, to figure out the staffing that would be needed to do that, and what staffing we have that could do that. And then our English learners and our economically disadvantaged students, not necessarily duly identified, but again, staffing needs to staffing to meet the needs of this cohort beyond their cohort days in person, and we're examining options for in-person opportunities for these lowest students. So we are looking at those. That's the information we're required to share with the state by the end of the week. So I don't know if there's any questions. I was going to unshare this. Is that okay? There's something on here you want to see before I shut it down?
Dave, I don't need to see it. Just one question. The hybrid model at the middle school.
Yeah.
Are the cohorts staying in one room for the most part?
Yes, for the most part. I believe the plan is to have the teachers move between the rooms.
Have the teachers move.
Right. Obviously, science might be a little difficult if they're doing a lab, but to minimize that, yes.
Okay. So the hybrid model for the middle school, as of now and as is written, does require the use of some of the interior rooms without windows.
Right.
But going through the toolbox of minimizing risk as much as we can, knowing we can't minimize all of it, just risk reduction. Mm-hmm. If we have a cohort of kids who are in an interior room at the Coakley all day, we're keeping that cohort as small, like 9 or 10.
We're actually looking at probably trying to find some sort of other space for them to use, perhaps outside than an interior room.
If there's a cohort of 9 or 10 kids in an interior room at the Coakley, they would have access to outdoor space at times throughout the day.
Right, or they might be out. Right. Yes.
Okay.
That's again, every answer creates 3 more questions. So that was the original piece at the beginning of the week, and just about 3 hours ago, it was determined that interior rooms should not be used. So now we're going to be looking at other options. The suggestion from Dr. Frazek would be to start with tents, and then look at if this model continues, looking at portable classrooms.
Yeah, I mean, you already know this, but I'm uncomfortable with the interior rooms being used. But when we're looking at risk, it's a very different story. If we were talking about a 45-minute class period in an interior room versus an entire day of a cohort of the same kids. So I want to clarify that. And since we have to vote on the document, can it be edited, like that section that you had highlighted, Dave?
Yeah, I'm going to edit that. We cannot use interior rooms. We're going to have to look at outside spaces or portable classrooms. That's what I meant.
Okay, thank you. Other questions at this time on the form? Maya?
Dr. Thompson, I guess I got a little bit lost about what we were talking about at the high school. I know that we're talking about basically, like a half day in school and then, lunch at home and then a synchronous remote part, which I don't have any issues with that. But do we still have a blue and gold cohort, and how does that work?
Yes, yeah, you still have a blue and gold cohort, and you still have a Wednesday all remote day.
Okay, because you were saying something about not wanting to go in one day a week or something. I got a little confused as to, I wasn't quite following.
I could very well have been babbling. No, but it follows the same format. So you have a group of kids come in on Monday and Tuesday, and they rotate through a morning set of in-person classes, grab their lunch, go home, and get back online for synchronous classes. And with that 2-day in-person or that 2-day cohort, they're going to have at least one class in person and 2 synchronous during that time before they get into the 3 full remote days, which will also have check-ins and what have you. So,
all right, great. Okay.
So there is going to be teaching going on, for 3 different periods over those 2 days for that one class.
Right.
So they'll have, freshman English 3 times, one of which will be in the English class, 2 times with the English English teacher, online with them, presenting lessons and going through. And then after that, they're going to be doing somewhat asynchronous learning and project-based pieces along with that.
Okay. All right. Thanks.
Right. So, yeah.
Other questions from the committee on the form before we vote on it? Okay, is there a motion to approve the template in front of us tonight?
So moved.
Thank you, Maya. Is there a second?
I'll second it.
Seconded.
Thank you, Dave. Any further discussion? All in favor?
Aye.
Aye.
Okay, unanimous.
Thank you. And I will keep sharing little bits and pieces as they come across my desk. I'm sure you see my emails coming and you get very excited, but try to contain yourselves. But there still is more guidance we're waiting for, specifically around standards, guidance around teachers' children's going to school, and a few other things. So it just keeps dribbling out, usually at 10:30 at night, so the papers can look at it before I can even drink my first cup of coffee. But we'll talk about that another day. Thank you.
Dr. Thompson, do you have anything else under late agenda?
I think that's enough. So
okay. That's what I thought. Just didn't want to cut you off. So we do not have any budget, old business, policy, or new business tonight. I know the agenda probably looked a little deceptive and few items on there, and yet it was still a 2.5-hour meeting. But the last item on our agenda tonight is consent agenda. So we do have a donation, Dr. Thompson.
Yes, another donation from Bay State Textiles, although of $632.50. I think we're catching up with these.
Okay. Is there a motion to approve?
Dave, motion to approve.
Thank you, Dave. Seconded by Joan. All in favor?
Aye.
Aye.
All right, unanimous. So at this time, school committee addenda. Dave Catania, did you have anything this evening?
Still working on that speech, so next time.
Okay. lucky we meet again next week. So.
Yes.
Anne Marie.
Nope.
Okay. Joan.
No, just encourage parents to look on the Norwood Public Schools website to see the 3 models that Dr. Thompson was talking about in more detail and start having those conversations with their families.
Yeah. Maya?
Nothing for me tonight.
Just briefly, obviously all of this is extremely complicated, and there's a lot of things going on in every single department trying to make this work. And I know that in addition to the grant writing that Jill Driscoll had mentioned earlier with Patty that she's doing, that a lot of the individual departments are really trying to figure out, how to make this work. And Eli in food services recently applied for a grant, and he had reached out to, I believe, Segal and Tony Mizuko, Dr. Thompson, Dr. Wyeth, and I to write letters of support for the grant. So I did write a letter as the chair of the committee that I'll share with everybody to support that grant, and hopefully we get that grant money. And I know through conversations that Dr. Thompson and I have had with Chris Capizzo, the director of Extended Day, that there, are some challenges there as well. She is also trying to look through some grant money, and the childcare industry, and in particular Extended Day, that kind of gets stuck in between public school and childcare. There really hasn't been any discussion yet, at our state or federal level of, helping that industry with money. So she was doing some research, and she might be bringing it forth to us as a committee to maybe do some advocacy and write a letter for funding for Extended Day. So just to share that might be coming our way. And then Dr. Thompson and I were talking yesterday about possibly doing some writing and advocacy on the federal funding. So I just wanted to give the committee a heads up that that'll probably be on our next agenda, talking about federal legislative advocacy. But on that note, the next thing on our agenda is executive session. We do need to go into executive session to discuss some negotiations. We will only resume for the purpose of adjournment. So I do need a motion to go into executive session.
So moved.
Thank you, Dave. Second on that?
Second.
Thank you, Marie. And then I do need to poll everybody individually. So Dave?
Yes.
Anne-Marie?
Yes.
Joan?
Yes.
Maev?
Yes.
I'm a yes as well. So I will see all of you momentarily. To everybody else, have a good night. Check out the resources that Dr. Thompson referenced, and we will see you back here next Wednesday, August 5th.